Good afternoon, good evening, everybody, depending where you are. My name is Sandro Galea, and I have the privilege of serving as Dean of the Boston University School of Public Health. On behalf of our school, welcome. These events are meant as spaces where we come together for the conversations that shape a healthier world. They provide opportunities to engage debate and sharpen our thinking about the issues that matter most for health. Thank you for joining us for today's discussion. This is part of our Challenging Public Health series. We started the series with the goal to take a self-reflective look at public health, particularly during this COVID-19 years, to reckon with our strengths and shortcomings. During the pandemic, we had to make hard choices, often based on incomplete or evolving information. Sometimes we chose well, sometimes less well. I've written about these choices, as have others within public health. Supporting health in time of difficulty means learning from our mistakes and using these lessons to get better at what we do. To inform our thinking, it's always helpful to hear from voices from outside of public health, allowing us to see our work with fresh eyes. This is why for this series, we have asked people from outside of public health, people whose work we admire, to come join us in a conversation within the public health community. The goal is to invite guests who can help us hold a mirror to ourselves to better see what we have done and how we might improve. Today, we have the privilege of welcoming a speaker who has broadened our understanding of the forces that shape socioeconomic opportunity and, by extension, health in this country. Ian Rowe is a senior fellow of the American Enterprise Institute. His work focuses on upward mobility, education, adoption, success sequence, and family formation. He's the co-founder of Vertex Partnership Academies, a new network of character-based international baccalaureate high schools. His other roles include chairman of the Board of Science, Chapin, a nonprofit adoption service organization, and co-founder of the National Summer School Initiative. He serves as a senior visiting fellow at the Woodson Center and is a writer for the 1776 Unites campaign. Ian was formerly CEO of Public Prep, a nonprofit network of public charter schools based in the South Bronx and Lower East Side of Manhattan. And before joining Public Prep, he was Deputy Director of Post-Secondary Success at the Bill and Melinda Gates Foundation, Senior Vice President of Strategic Partnerships and Public Affairs at MTV, Director of Strategy and Performance Measurement at USA Freedom Corps Office in the White House, and co-founder and president of Third Millennium Media. He is published widely in places like the New York Post, Wall Street Journal, Washington Examiner, and is often featured on talk radio shows. He has a new book, Agency, published by Templeton Press, seeking to inspire young people of all races to build strong families. I'm now delighted to welcome Ian Rowe. And the format for this event is Ian is going to speak for about 15, 20 minutes, and then I will do a Q&A, and then I will take questions from the audience, which I will facilitate and direct at Ian. Ian, pleasure having you. Thank you for joining us.
It's such a great honor to be here, and thank you for that introduction. I'm exhausted just listening to it. But I am, yes, I'm very excited to be here and happy to join in this conversation about challenging public health. I have to say that I'm somewhat hopeful that this discussion will lead to ideas that also challenge my world of public education, because I think there's much that the two sectors can learn from each other, particularly when we think about this idea of the social determinants of health and education, which often overlap. And as you mentioned, I am a senior fellow at AEI. I also run schools in the heart of the South Bronx and the Lower East Side of Manhattan. I'm obsessed with this goal of upward mobility. And for the last decade, I've run schools really trying to help young people understand what are the ingredients that most likely contribute to their upward mobility. As you mentioned, I just launched Vertex Partnership Academies, which is going to be an international baccalaureate network of high schools. And prior to that, I ran a network of all girls and all boys public charter elementary and middle schools. And those schools, we had more than 2,000 students in our schools, primarily low-income Black and Hispanic students. Each year, for a few hundred open seats, we had nearly 5,000 families on our wait list. And these parents, wanted schools that helped their kids develop the kinds of skills and habits to become agents of their own uplift and to build a better life, even in the face of whatever barriers that they may have faced. And the school we just opened back in August of this year in District 12 in the Bronx, of the nearly 2,000 students district-wide that started 9th grade in 2015, 4 years later, only 7% graduated from high school ready for college, meaning that they started 9th grade and either they dropped out or they actually did earn their high school diploma, but still could not do math nor reading without remediation if they were to go to college. So as we as a country are having, very crucial conversations about race, the pandemic, all these factors, it's easy to forget that particularly racial disparities that we are often seeking to close as adults almost always originate much earlier in life, long before they show up as statistical gaps in financial wealth or health outcomes or home ownership, crime rates, educational achievement. I mean, if only 7% of the mostly Black and brown kids in the Bronx district that we just opened our school are graduating from high school capable of doing even basic reading and math, why would we reasonably expect these same kids to flourish in higher education and the workplace as adults, or starting businesses, getting married, having children within marriage, or experiencing any of the sort of typical landmarks along the pathway to a healthy life or entry into the middle class or beyond? If we truly care about upward mobility, and I think that includes, long-term health outcomes, we must be wary of what I consider the meta-narratives that, in my experience, dominate the world views of how young people increasingly are shaping their sense of possibility and their belief as to whether or not they can achieve the American dream. These two meta-narratives I call blame the system, and the other is blame the victim. In the blame the system narrative, if you're not successful in this country, the reason you aren't achieving the American dream is that America itself is the problem, right? According to the discredited New York Times 1619 Project, the country was founded on a lie. America was founded as a slaveocracy, not a democracy. The founding principles were false when they were written, that anti-Black racism runs in the very DNA of the country. In Blame the System, America is an oppressive nation. Critical race theory insists that every institution is steeped in racism, that there is a white supremacist lurking on every corner, that capitalism itself is evil, that these systems are all so rigged, so discriminatory, that the individual is powerless and only massive government intervention is the solution. Now, by contrast, there is a blame the victim narrative. And in that scenario, if you're not successful, America's not the problem. America's great. You are the problem. In this conception, America is full of opportunity. And that if you're not successful, then you are the cause of your own failure. You have some pathology. You should have pulled yourself up by your own bootstraps. Now, each of these narratives, blame the system, blame the victim, like I confess, actually have a grain of truth in them, right? So in the Bronx district, in which only 7% of kids are graduating from high school ready for college, there's a cap on charter schools. So if you had an idea to launch a great school, you literally could not. Like that's an example of a real systemic barrier. A 7-year-old can't solve that problem, right? So that's a blame the system type affirmation. But on the flip side, in the blame the victim narrative, there's always an element of personal responsibility that must be called upon. But we can't ignore the effect of what happens to children in education or in health outcomes if they do not have the support of strong families or the support of a faith-based organizations and schools to help develop their capacity to exercise their individual responsibility. Nevertheless, together, these two half-truths of blame the victim and blame the system add up to what I call a singular lie. They rob young people of the sense that they can control their own destiny, which again includes their own education, their own health outcomes. In my experience, Dean shared some of my background. In my experience working at Teach for America, the Gates Foundation, the White House, MTV, running schools for nearly 15 years in low-income communities, like I have worked with myriad young people. I've worked with rich kids, poor kids, homeless kids, foster care kids, abused kids, white kids, Black kids, Asian kids, every kind of kid. And, I've been doing this work now long enough to see many of the young people who I may have engaged with in elementary school, middle school, they are now making their entry into young adulthood. And what I've seen is that some kids who are raised in challenging situations, unfortunately, recreate the same challenges in their own lives, perpetuating the cycle of poverty or despair. But other kids seem to take very different paths of decision-making, paths that often lead to lives of prosperity. The animating question of my life has been, what makes the difference? Why do some young people succumb to the conditions that they're experiencing, while others thrive in making different kinds of decisions for their own lives? If we can find the answers to these questions, then I think that should influence what we teach the rising generation to create the conditions for flourishing in their own lives. And again, that means flourishing in education, health, and a whole series of areas that we're all concerned about. So as I thought about this question of my observation of the students who thrive, who change their conditions, my observation is that they had a sense of what I call agency. And I define agency as the force of your free will guided by moral discernment. The force of your free will guided by moral discernment. So think of agency like a vector, right? Or velocity, where velocity is not just speed, it's speed and direction. So if agency is free will plus moral discernment, where does that moral guidance come from? No one is entirely helpless and no one can truly make it on their own. Agency is individually practiced, but socially empowered. The young adults who I've seen succeed have typically embraced 4 pillars: family, religion, education, and entrepreneurship as they make their decisions into young adulthood. So what do I mean by those 4 pillars? So for family, regardless of the family that a child may be from, it's the family that they form that creates such a strong foundation of success. That's why it's important to teach concepts such as the success sequence that the dean mentioned in school. If you're not familiar with this data, if a young person finishes just their high school degree, gets a full-time job of any kind, just so they learn the dignity and discipline of work, and if they have children, they got married first, 97% of millennials who follow that series of decisions avoid poverty. It's not 100%. The vast majority enter the middle class or beyond. So it's not a guarantee, but it's certainly powerful data that, in my view, young people deserve to know. And that's one of the anchors of my F.R.E.E. framework for how we get more young people to understand the series of decisions around family formation, which arguably is one of the most consequential series of decisions that a young person can make as they enter young adulthood. My observation also has been that students that were successful into young adulthood usually had some type of personal faith commitment. They knew that they were not alone, that they were part of a community of people that loved them and regularly participated in real-world rituals that adhered to a moral code and a sense of purpose. I've also observed that, the third E in F.R.E.E. in education, that students that were successful usually benefited from some type of educational freedom or school choice, whether it be a charter school, a religious school, even within the public school system. Somehow the parent, the caregiver had the ability to choose a school that was best designed for their child. And then finally, in my observation, those kids that were usually successful, they built a strong family, had a strong faith commitment, had benefited from educational choice in some way, they typically had the last E, which was the entrepreneurial spirit. And by entrepreneurial, I don't mean just starting a business. I mean being a problem solver in your own life by valuing hard work, by being a problem solver, even within your own workspace if you're in a traditional setting. So my hope, and through my book Agency, is to connect young people to these four pillars: family, religion, education, and entrepreneurship. What I call a revitalization of the four sort of local mediating institutions, where in some ways family, religion, education, then entrepreneurship is almost like the payoff that drives human flourishing. And just to give you a sense of, like, when I talk about family, for example, it's not just about encouraging young people to think about their own family formation. It's also incorporating family structure into the way that we typically assess how many of us look at outcomes in healthcare, in education, because it's often a missing piece. And this is an area, Dean, I'm excited to talk to you about, in an area that I'm actually in public education, hoping to learn from public health. So in 2010, the National Center for Health Statistics put out a report called Family Structure and Children's Health in the United States. And in this report, it says, quote, "In view of the changing family structure distribution, new categories of families, such as unmarried families or unmarried step families, need to be studied so that the health characteristics of children in non-traditional families can be identified," end quote. The report defined 7 distinct and mutually exclusive family structures: nuclear, single parent, blended, unmarried, biological or adoptive, cohabiting, extended, and other. It's very interesting. And this report then observed that children, this may be intuitive, that the children found to have the most consistently positive health outcomes were raised in nuclear families, right? That is a living, children living with 2 parents who are married to one another and are each biological or adoptive parents to all children in the family. Now, one might say, well, duh, of course, that's the structure that's going to get better outcomes for kids. But the reason it's so important is that this analysis, or this prism through which we typically evaluate performance of whether it can be education or health, rarely is family structure focused in on as the primary lever. Let me give you an example. Just a few weeks ago, the National Assessment for Educational Progress released the data on reading and math outcomes for kids in our country. And not surprisingly, after a couple of years of COVID and closures and masking and all that, what was already a perilous situation, the fact that only 37% of all kids in our country were reading at grade level, massive declines in literally every single state. And so you saw lots of analysis by race, by class, by gender, all coming up with theories of causality. And I would defy you to see if you've read any analysis which showed, well, what were the differences in reading and math scores by family structure? So I have now been doing some digging in terms of the data, what's called the Data Explorer, and we found at a very rudimentary level, kids being raised by, this is only the data that NAEP carries, mother and father, performance in ELA and math is at least double of any other category of family structure, which is a huge finding, and yet it's not part of the analysis. So the reason this is important is that if you're doing analysis of a particular set of outcomes and you only have a mindset that, well, if there are racial gaps, then there must be, my theories tend to lead to racial causality, right? Or that if there's racial disparities, there must be racism, for example. And so if your theory of causality is narrow, then guess what? Your theory of your solution set is also narrow. And so we ignore transcendent factors like family structure, which I have advocated for significantly within the world of public education. So this is an area that I'm actually, with my colleagues, trying to show that in public health, they've actually made the recognition that family structure matters. And it's not to say that other factors don't matter, but when we ignore something that's so fundamental, in some ways so obvious, particularly as it relates to what then should be the solution set, we ignore the opportunity to educate the rising generation about strategies that they can deploy within their own lives to make outcomes very different. So all of us who are interested in breaking the cycle of poverty, breaking the cycle of disadvantage, breaking the cycle of poor health outcomes, we know a lot about what contributes to healthy outcomes today, for kids today. Why not apply those lessons as relates to what we're teaching the rising generation? So maybe with that, we can start our conversation.
Well, thank you, Ian. I appreciate your remarks. There's much that you said that I agree with, and some I disagree with, which makes it interesting. Let's start with point of agreement, perhaps. You mentioned in your remarks implicitly and explicitly that individual agency matters. You were very explicit about that, but you're also pretty implicit that there are also systemic forces that hold some people back. And part of my dismay sometimes is that we allow ourselves in camps that it's only individual agency and or it's only systemic forces. So can you guide us a little bit through how one brings the two together? How can we actually constructively recognize that there is individual agency and also systemic forces? And how do we actually bridge the gap between the polarizing extremes on either side?
Yeah, well, first of all, I think it's a fundamental question, because we can't seem to make progress if we're not really acknowledging the nuances of what's happening on a day-to-day basis, particularly in the lives of kids. And I will confess to you, even in doing my own work, I have observed, I guess, or critiqued many people who one would put in the category of blame the system, right? So I'll give you a quick example. So Nicole Hannah-Jones, who's the lead author of the New York Times 1619 Project, a prolific writer, she has argued significantly, particularly in the Black community, that reparations needs to be part of the answer. There needs to be something like $14 or $15 trillion government redistribution program to make up for past slavery. And in fact, she says it doesn't matter what a Black person can do. They can't make up the racial achievement gap. Doesn't matter if you get married, doesn't matter if you get educated, doesn't matter if you buy a home, doesn't matter if you save. Quote, none of these things make up for 400 years of racial plundering. And she wrote this in a piece called What We Are Owed, an 8,000 piece in the New York Times Magazine a couple of years ago. And so that's very much kind of a blame the system. You can't be successful unless the US government does these things. And of course, meanwhile, in her own life, she's done all four of those things to be successful, right? But nevertheless, I push back on that kind of ideology because it creates this impression that the system is so overwhelming, our history, present day discrimination is so overwhelming that you can't get ahead, right? But I also started to realize that, you know what, I can't totally critique that without acknowledging that there are some issues where I then start hearing folks who are sort of blaming the victim, saying, yeah, it's all your fault. Look, this country is paved, the streets are paved with gold. And if you're not successful, I mean, look at all these successful people that are out there. Why aren't you? And so I decided to name both of these forces in my book to hopefully acknowledge, typically to those on the center right and those on the center left, more progressive, more conservatives, that some degree, I hear you. Like, I hear both sides of this argument. We have to have the courage to acknowledge that there are parts of our arguments or parts of our opponent's arguments that are actually legitimate, right? And so I think it actually starts there, that we just have to be honest, that there's an element of personal responsibility always, and there are elements of the system. I named one, and we just got sued by the teachers union in opening this great new high school in New York. Like, that's part of a systemic barrier. We won, but if we're not acknowledging these things, then we're not going to make progress towards better outcomes for kids. So that's my attempt. Is I see it too frequently, just what you just said. There are folks who are in polarized camps, and if you don't fully subscribe to the doctrine of blame the system, blame the victim, then you're immediately ignored. And I just think we have to be able to figure out ways to cross that impasse.
Well, let me let's dive into that a little bit more. So, leaving aside sort of historical arguments about the 1619 project, which I don't think either of us is an expert in, but leaving that aside, and we can leave that to others to debate. And being explicit about the fact that I've actually written in arguments that in order to achieve, for example, narrow health gaps, black-white health gaps, you actually need some sort of reparations, because otherwise you won't get there quickly enough. So just to be upfront about where I come on that issue, it seems to me like
And wait. And how do you define that? How do you define reparations?
Well, I actually, in what I've written, I have not gotten into that, because I think that is a whole other set of complicated conversations. Okay. So we could discuss that, but there are people who actually, I think, are much more expert in what that actually is than I am. Yep. But let me get to the point that I think part of the tension you were alluding to is the population versus individual tension. Like, to my mind, it's not a contradiction to say that in order for a particular population, as identified by any metric, whether it's race, whether it's ethnicity, whether it's a sort of education of their parents, however you want to define it, that a certain population might need systemic intervention in order to achieve outcomes that our population has. That is not in contradiction with the fact that within a population, there's tremendous individual heterogeneity, where particular individuals are going to be outstanding and they're going to achieve quite a bit despite the potential disadvantages of being part of a population. And I feel like in the public conversation, we conflate those two, where we say, well, because X, look at X, they are an outstanding achiever, therefore surely the category to which X belongs to could not be disadvantaged. But that is simply wrong.
So I think what you're raising right now hinges on how you're defining what disadvantage or advantage hinges on, right? So the reason I talk about this idea of monocausality is that so often when you're in debates, whether it's on education, healthcare outcomes, there's certain characteristics that seem to rise to the level of that almost suck all the energy out of the room. Whether it's race or gender, oftentimes it's about race, where it's just like that singular force is greater than any other. And and you just mentioned disparities. I often use this example in the world of education. We have a similar kind of thing where, whether it's national assessment for educational progress and you're reading math results, almost always, it doesn't matter. It's like we're obsessed with black, white reading gaps or Hispanic white reading gaps. I presume there's probably similarities in healthcare. And yet, when you look at the data in the entire history of the National Assessment for Educational Progress, often known as the nation's report card, since 1992, there has never been a situation in which a majority of white students are reading at grade level, right? 4th grade, 8th grade, 12th grade, something like 45% of white students has been the highest level that are reading at grade proficiency. So when we become so obsessed with, and as I think we are in education, closing the racial achievement gap, all that means is that we will have achieved some progress, but we'll have achieved what I call universal mediocrity. And so there are a lot of other factors that drive outcomes. It's unlikely that systemic racism is the reason that the majority of white students have not been reading at grade level since, again, the early 90s, or since this reporting even started. So That's why I want to expand the scope. And when we say there's a group that's disadvantaged, you know, like let's take the racial wealth gap. What does it mean when we often talk about, like, again, the average Black family makes has about a tenth of the wealth of the average white family? That's a real thing. And yet, when you take into account just a couple of other factors, family structure and level of education, the average Black married college-educated family has about $160,000 more wealth than the average white single parent family. And the racial achievement gap, racial wealth gap is about $160,000 the other way if you take into account race alone. My point is that when we have this discussion, I just want us to move away from the simplistic and finite set of usual suspect categories that often define these debates. Certainly in education, I would imagine it's very similar in health, when frankly, the world is far more nuanced than that.
Well, we're singing from the same hymnal about the world being nuanced. And I like your push away from monocausality. I have in my own disciplinary world, which is epidemiology, I've written for years against thinking about causal isolation and thinking about multiple causes that influence well-being, which is my world, health of population. So we're in agreement on that.
So let me ask you a question.
Sure.
Because,
I guess we can turn the tables. Go for
it. Well, no, because sometimes we get into this accusations of moralizing and you're pushing the ideal. So let's just share with you one data point. The poverty rate for Black married couples has been in the single digits for generations, right? And again, we're often concerned with poverty, particularly by race, by a quote unquote disadvantaged group. And yet, here's this particular statistic, it's been studied by every left, right, the data reaffirms itself. And so a logical conclusion one would say is, well, then should we be encouraging strong marriages, strong family formation as part of a long-term strategy, relative to the Black community or any other community, if we know that there's such a high correlation? I try to stay away from words like causality, but if there's such a deep correlation, should we be teaching these things? And I'm just curious, because I often get pushback that when we do start to expand the definition of these things, of what may be causing negative disparities, or more importantly, what would typically drive success, you're kind of accused of, oh, you're pushing things with a moralistic agenda, as opposed to, I don't know, things that are that have to do with personal choices, as opposed to things that are related to immutable characteristics. And anyway, I'm curious how you.
Well, you yourself used, I made a note here, this sort of combination of free will and moral discernment. And I agree with that. And I often talk in my own writing about the need for us to advance arguments through a combination of empiricism and moral argument. And I think we can't escape from moral argument. And in many respects, I think it's cleaner to keep moral arguments separate from empiric arguments. But, I would argue that this is part of the frame shifting you're trying to do. When you say you want to expand your causal frame, what you're really doing is you're setting the parameters for the moral argument. And you're also setting the parameters within which the empiricism happens. And I think that's okay. Now, let me get back to, though, let me push you a little bit. I hope you don't mind.
Yeah, of course.
I do feel like in one of your comments, you were perhaps throwing the baby out with the bathwater, because you said, well, systemic racism is not sort of one of the drivers because Black family, college educated, has the savings. I can't remember the number, but it doesn't matter. And let's look at a white family, which is not college educated. Well, surely the comparison.
And single parent.
But surely the comparison is college educated Black family and college educated white family. And insofar as one can adjust for multiple variables, if the wealth gap between those two remains dramatic, as it is, and we know it is nationally, that speaks to some characteristic that distinguishes those two families, which in this context is race. So it seems to me not in contradiction to say that systemic racism is one of a set of ubiquitous factors that influence achievement in our society, at the same time as saying it is also a really important factor in particular contexts.
So I will cautiously agree with you, because I think what happens here, and this is why it's so hard to have these conversations, which is that it's to the extent of the degree to which these factors are driving whatever set of positive or negative outcomes you are trying to make your case. So I, as a Black person, have certainly faced discrimination in my own life. It exists. It has existed. It will exist. Sometimes it's individual, sometimes it's systemic, like, for example, the fact that there are caps on charter schools, which disproportionately hurts Black kids and low-income folks in New York City. So I don't know if that's a race, I don't know if that's systemic racism or it's a systemic barrier that disproportionately hurts Black kids, but whatever, if you're on the receiving end of it, it's still a systemic barrier that is a real one. So it's hard for me. I mean, people have accused me, you're denying systemic racism, you're denying these barriers. Like, no, they exist. I just don't accept the premise that they're insurmountable. So the reason I try to bring these examples out, for example, married Black families, the vast majority don't live in poverty, is A, it's almost never part of these conversations, but B, it offers like, well, yes, if both things can be true, that there are these forces opposed to, and yet there seems to be a set of common characteristics that leads to success on a relatively reliable basis. What do we make of that? And what should we teach young people about the choices that they make that can help more likely create the conditions that seem to lead to success? That's my, as an educator, and I presume as someone who's, educating people who are now going to be going to healthcare, how do we educate more professors, doctors, of what are the kinds of things we're wanting people to do to increase their likelihood of success? So I agree with you. We can acknowledge that systemic racism exists, that there are these forces, but to what degree? And I would argue the force of systemic racism absolutely is lower than what existed in 100 years ago, 50 years ago. We're certainly not out of it, for sure, but constantly ignoring other factors, which in my view are far more determinative of success, hurts the very people that we're seeking to uplift.
Well, I think we can readily agree that a matter of degree is always what bedevils the public conversation. It gets so dichotomized. Let me just pursue this a little bit more. Then I want to get to education, but we'll get to that in a second. So you've had such an interesting background in that you've sort of been in what I would consider to be perhaps more traditionally liberal circles and traditionally conservative circles. So you've somehow figured out a way to navigate all of that. Congratulations to you. Can you just comment a little bit about how you've navigated being part of conservative circles in the past, let's say, 6 years, 7 years of fairly dramatic polarization that as sort of galvanized by one figure that sort of perhaps inarguably brought out the sort of the worst in polarizing impulses on the right of the political argument?
It's really hard. I mean, let me just say from the outset, once you wade into issues of race, gender on a national scale, and you're trying to talk about things like causality or new types of solutions, there's going to be pushback. And I have lost friends, I've lost colleagues. But my general approach is to try to lead with empathy first. Like, demonstrate that I actually care about these outcomes for kids. Like, I don't run schools in the heart of the South Bronx because I'm some callous ideologue that, just believes whatever, and someone who doesn't like my view of thinking. I actually care about what happens to kids. And if I thought that a lot of these theories around, for example, anti-bias training or reparations or all these things, or telling kids that the world is rigged, world is rigged against them, I'd say, sign me up, I'm all for it. But when I see the impacts of what I call learned helplessness, I just have to fight against that without losing my foundational empathy that I agree with even people I disagree with. Like we both see the injustice that's happening. I mean, I live in a small town in Westchester. When I drove to our school today in the Bronx, it's a different world, right? So I'm with you. I just disagree on the strategy. So in addition to leading with empathy and agreeing that there is an issue, the second part of what I try to do to sort of turn down the temperature is to at least have an empowering alternative. What is it? So I'm just not shouting in the rain. I'm just not saying that's a stupid idea or that's no. Like, the onus is on me to then say, okay, well, what is a more empowering framework that young people can say yes to that would lead to the kind of prosperity that you say is so possible, Ian? And so that's why I created agency as a framework based on my own observations of what I see young people who succeed over a period of time, what they usually embrace in their own lives. The challenge is that not all these things can be solved through policy or some top-down intervention. It's a moral argument. It's persuasion. It's just talking these things through. But to try and do it in such a way that I'm hoping that I'm, as authentic can be in, like I've committed my life to helping children have opportunities in the same way that my parents created opportunity for me. So I think that's how I try to navigate. Lead with empathy, have an empowering alternative. And yeah, you got to have some thick skin too, because, there are people who want to preserve the status quo who will just come at you because the things that I say challenge the premise upon which whatever they're saying is the right way.
Thank you for the leading with empathy. I think that's actually really important. Let me shift course to ask about something different. Let's talk a little bit about COVID for a second, because you've been you live in the schools, in the school system, and of course during COVID, we've had this really difficult situation of thinking about how to protect ourselves from COVID, keeping schools open, not keeping schools open, recognizing that masks have clear benefits in terms of preventing transmission of virus, thinking about masking and their impact on kids' social, emotional development. These are, I think, everybody who thinks about these issues recognizing that these are difficult issues around which there is no simple answer. I'm actually wondering if you can talk us through a little bit how you've dealt with it in the schools that you're intersecting with, and what, perhaps I want to know what wisdom you've had that's emerged from this tricky moment.
Yeah. So to your point, I think at the beginning you said that we were dealing with incomplete information or changing information, and we have to give some grace. I mean, there are people now who are like, I knew it all the time. This was an outrage. We knew that learning loss was going to happen. We knew that we shouldn't have closed schools. Well, this back in March of 2020. I was in New York, and again, I live in a small town in Westchester. New Rochelle was the epicenter. New Rochelle was the first major case. Mm-hmm. And like here we are, literally like 2 miles. And suddenly we're setting up this huge center in Orchard Beach and for COVID testing. And the vast majority of us did not know. There were people speculating, certainly more people who now claim that they knew from the beginning. So I just think we have to give some grace. Did I think as we got into September, we wanted to open schools? So we were a bit more aggressive on opening schools in person, masking and all that. And again, I'm trying not to be kind of finger pointing, because I just think there, but for the grace of God go I. Like, none of us had complete information. And again, there are those who are claiming that they knew from the very beginning. I can't be in that camp. What matters to me now is what we're doing today. And even in New York, there are people now, there's some leadership who's saying, well, there's some COVID outbreak, we may have to go back to masking, we may have to go back to closures. That's where I draw the line. Like, I think we've learned enough about how to continue in-person instruction. I did found a national summer school initiative where we were educating 12,000 students in 17 states remotely. And so there was some strong value in that, but there's nothing like strong in-person instruction. I mean, we're running a school right now. If COVID comes along, we will deal with it. So I don't know, maybe this is an incomplete answer, but I have a lot of empathy for many school leaders who in the early March through September of 2020, who were, we didn't know, we didn't want to hurt kids. And I was one of the more aggressive ones to say, well, we can reopen, but I wasn't like casting dispersions at those who were making different decisions. And I don't know, we live in a society where it seems like everyone wants to be a winner or a loser right now, and it just wasn't. These calls were not so easy. I feel today we're in a very different situation, but we have to have some grace and allow people to make mistakes. But even the word mistake suggests that it was a mistake at the time, and you're doing the best you can. And I'd much rather figure out a way that we as a nation move forward together, knowing what we know, and how do we achieve levels of excellence that weren't happening, by the way, even before the pandemic. So maybe we should all get some grace and say, our theories of causality that we thought were driving all these not great outcomes, maybe there's something we reset now and figure new ways to work together.
Well, thank you for adding grace together with empathy in the conversation, because I agree with you entirely that I think there's been an undue amount of sort of revisionist certitude when we were going through it. There was a lot that none of us knew. Let me again change tack a little bit, if you don't mind, but sticking with education, because in public health we talk a lot about, and I think we all understand the importance of early childhood education, early education, in order to create a life course trajectory of educational achievement and then health achievement. And so one of the things that I think we care about a lot in the public health community is about creating equity of opportunity and creating an openness of the experience towards excellent education for kids of all sociodemographic, racial, and ethnic groups. Can you talk a little bit about how one goes about achieving it? How does one go about achieving a equity of opportunity for people from a range of backgrounds? And maybe as a corollary, touch a little bit on the role of things like testing and the extent to which that is either a barrier or facilitator, how you've come to see that. How do we, I think you and I agree on the fact that we want maximal opportunity for people of all stripes, but as defined by all dimensions, to be able to have an excellent education, to have a rich, thriving life. How do we do that? How do we do that given how far we are from achieving that right now?
Yeah. So, start early with the end in mind. That's if people who worked for me know that that's my mantra over and over and over and over again. Start early with the end in mind, right? So if we want to maximize opportunity, so I ran elementary and middle schools, and this is a very concrete example for how I think we tried to achieve this idea of equality of opportunity. So when we launched our network, we were, this was a few years ago, kindergarten through 5th grade. And, kids were coming into kindergarten woefully behind. So you talk about inequity. They had not had positive early learning experiences, very rarely even high quality pre-K, all sorts of challenges, in my view, that we became one of the first charter schools in New York City to launch pre-K, to partner with Sesame Street to create a really robust program for 4-year-olds. And we certainly made some good progress in catching kids up, increasing vocabulary. But the point is, even at 4 years old, we saw huge inequity as it relates to vocabulary acquisition, social emotional learning, school readiness. There were already huge gaps. So what do we do? So what we observed, because we're a charter school, we observed that the younger siblings, so imagine a mom is dropping off her 7-year-old to second grade, and often she's got her stroller with her with a toddler. And because we have sibling preference in our schools, we knew that that toddler in a few years would be coming to our school. Is there anything that we could do to address this inequity so we can create a more of a level playing field by the time that that child came to our school? So we created a partnership with something called the Parent-Child Home Program, which is a 2-year early literacy home visiting partnership. So imagine an early literacy specialist who often is from the same community, in our case, the Bronx, the same community, visits the home of the caregiver and the toddler, so the younger sibling of our current students. So imagine 2 times per week, 30 minutes per visit, an early literacy specialist goes to the home of the caregiver, sits with the caregiver and the child to show them how to help the parent become what we call the at-home reading coach. So not only did the kid increase their vocabulary, the toddler, now because this is starting at 18 months old. So for 2 years, this occurred. And you got a book each week. So each time the early learning specialists were to call, they called 30 minutes before, turn off all the devices, make sure the TV's off, and so it became this, essentially what we wanted to do was build a capacity at home of the parent, of the caregiver, to say, you can now create a different environment that will lead to far different outcomes when that kid comes to our pre-K at 4 years old. It was, as far as I can tell, we're still the only ones. I think they're doing something similar in Newark. But that's how we tried to address this idea of inequity early. Because if we're waiting, this is often the problem. We champion trying to address inequity now when we're talking about kids who are in high school or college or the workplace. It's like, why do we? That's what I said in my opening remarks. We are deluding ourselves when again, let me just say this up from the beginning. It's never too late. We should always need interventions, right? But if we know, if we know that at age 2, age 3, age 4, age 5, that there's these huge disparities in vocabulary acquisition, huge disparities in social emotional readiness, and huge disparities in school readiness, then let's take the obvious steps, which is A, how do we create environments in school that are better, that are stronger, like having high quality pre-K, while also building the capacity at home, which is a far more influential environment for kids' development. And by the way, talk about healthcare outcomes. You got to go into the home. So that's how I try to generally deal with the issue of inequity, which is how do I build a capacity much earlier so that we avoid these issues in the first place? Because I will say to you that generally when I am seeing people who are trying to achieve equity, it's often not equity of opportunity. In my view, it's equity of outcome, which is sometimes leads to the kinds of interventions that I think are harmful. And I'm happy to give you many examples in education when equity, like you said something very important, you said equity of opportunity, which I can be down with. But oftentimes when we're talking about equity, there seems to be a focus on outcomes. And so therefore, the ways in which that's often achieved is to remove, in my view, those things that actually create equality of opportunity.
Well, but surely I understand the argument about the division between equity of opportunity versus equity of outcome, but surely we are looking to drive wedges when we try to contrast the two, because equity of opportunity is more often than not going to lead to equity of outcome if done right, which I suppose gets me to a question about your program, which is, how are you evaluating it? I'm just curious, how do you know you're a success? Because the process itself is not good enough. You actually want to have outcomes that are positive for everybody. So I'm just not sure that there is such a clear demarcation between the two.
Not everything that matters can be measured. I struggle with this, right? Because
a tough one. I agree, although of course you will agree that gives us a lot of wiggle room to then say things that we like matter when in fact we can measure
right,
them.
Right. So, in the world of education, I happen to be a fan of the SAT, the Scholastic Aptitude Test, which for decades has been a relatively good predictor of first-year performance in schools. The zeitgeist has unfortunately decided that the SAT is a culturally biased or racist test, and more colleges are abandoning it. I think that's a problem because in many ways, the reason the SAT was first created was because whole groups of people were being discriminated against, Jews, Blacks, and the whole idea is we need an objective standard so that an individual kid can demonstrate a level of excellence against an objective framework. That makes sense to me, because otherwise we're robbing young people of the ability to compete, to show that I can compete. The governor of Oregon a few months ago passed a law that said we're no longer requiring high school students to demonstrate proficiency in math and reading in order to graduate from high school. And she said she was doing it in the name of trying to help her kids of color. Like, what are you talking about? You don't take away standards. So there is an important, so I would say that in my how do I measure success, I do think there is a role for objective assessments that we do as much as we can to make them truly objective, not subjective, not inherently discriminatory, other than it discriminates against the people who are not prepared for them. In New York City, there's a whole argument, something called the specialized high schools, which are these, I went to Brooklyn Tech, which is one of the specialized high schools in the city, and I passed the test and all that. And we had a very racially diverse group of students in my class at Brooklyn Tech. It's significantly lower today, but I believe it's not because of the assessment, the specialized high school test. It's because we're falling down on the job of what we're doing K-8 or even prior to kindergarten. So it's a long-winded answer to how do we know what we're doing is working? One is, I think you have to have some objective assessment. So tests matter, but they just shouldn't be the only thing. And also schools, for example, do more than just reading and math. Like there's science and history and the arts. So I believe in sort of, multiple performance measures where a school gets to say, look, we are solid in academics. Here's how we're doing in reading and math and, sort of the core subjects, while we also value music and poetry or sports or whatever those things are that are probably harder to measure. But here's the way in which we are demonstrating what success looks like. And I think more and more schools should be given that freedom. I mean, there are other long-term things like what's the non-marital birth rate of the kids who graduate from your school? What's the long-term earning power? Like, I think over time, those things should be measured as well. I mean, we haven't been around enough for those kinds of measures, but I think that would be fair game if I'm positing that the things that we're teaching are hopefully helping kids make decisions that lead to a flourishing life. Okay, all right, well then prove it. It just takes time.
A senior colleague of mine once said, if we disagree, it just means we haven't talked long enough. And I feel like we could talk several more hours and would find a lot more convergence, but I'm aware of the time. I feel like it's only fair to let you have the last word. What advice do you have for public health? Do you have this conversation will reach many hundred people in the public health community. What advice do you want to leave us with?
Well, that's a weighty. I think I think leading with empathy is so important. I just feel like we're in a place in our country where those people who are not yet succeeding, and this is where the blame the victim, where you're kind of putting it on them. You know, we're it's like, why are you in the situation that you're in? I'll come help you. You know, I'm your savior. And that's not a good relationship. This kind of savior complex, which I often seem to observe. So if I would say advice, because I have the same advice for my colleagues in public education, lead with empathy. There are a lot of parents who desperately want their kids to have a better life than they have had. And whatever decisions they may have made in their own lives, whatever, you know, they still want the best for their kids. And so that means the highest of expectations. It means having conditions in your school that are what you'd want for your own children. It means creating an environment of excellence. And that's what for me, leading with empathy means, because I care about you. And I think that's what I would say for my advice to my public health colleagues.
If we can take from this empathy, excellence, and grace, that will be well worth an afternoon conversation. Ian, thank you for joining us. I realize it's unusual to talk outside one's field, and particularly in a group that is sort of thinks differently about some things than you do. And I appreciate you engaging with us.
No, very much. I feel like we could go on for another couple of hours. So that's always a rich. That feels like we are kindred spirits, and empowering alternatives, I think, is very healthy. So